Our today's topic is dental cement. Why do we use dental cement? The dental cement, they have a multiple use like restoration, luting, and therapeutic. In a dentistry, a cement will act as in a dentistry, a cement will act as a base, liner, filling material, or adhesive to bind devices and prostheses to tooth surface or to each other. As we look into the history of the dental cement, we found that the first used dental cement was silicate cement. Who gave the term silicate cement? It was given by Fletcher in 1871. Zinc phosphate cement by Otto Hoffmann in 1879. The term calcium hydroxide, it was given by Hermann in 1920. The zinc oxide eugenol was given by Chrysostom in 1942. And the glass ionomer cement was described by Wilson and Kent in 1972. So that is the history of the dental cement. So for entrance exam you have to remember who invented glass ionomer cement. It was Wilson and Kent. Who invented silicate cement? It was Fletcher. And calcium hydroxide, it was Hermann. Now how do we classify the dental cement? We can classify the dental cement into based on the ingredients. They can be either water based, oil based, or resin based. What are the example of the water based dental cements? They are glass ionomer and resin modified glass ionomer cement, zinc polycarboxylate cement, and zinc phosphate cement. Whereas the oil based cement, the example of the oil based cement, they are zinc oxide eugenol, non-zinc oxide eugenol. The resin based cement, they are composite and adhesive resin or compomer cements. We can divide the cement by the matrix type. The classification was given by O'Brien. So this is the classification as seen in the diagram. According to the Phillips, we classify the cement based upon their use. That can be either primary use or secondary use. Cement like a zinc phosphate cement, their primary use is for luting agent. So they are used as a luting agent for restoration and orthodontic bends. And secondary use is intermediate restoration. They act as a thermal insulator basis, or they can be used in root canal restoration. The zinc oxide eugenol cement, it is temporary and intermediate. It is used as temporary and intermediate restoration or luting agent or thermal insulating basis. Secondary use is for root canal restoration or periodontic bandage. The polycarboxylate cement, their primary use is luting agent, thermal insulating basis, and their secondary use is luting agent for the orthodontics band. GIC, their primary use is used as coating for eroded surface or luting agent for restoration. And secondary use is used as a pit and fissure sealant, anterior restoration, or thermal insulating basis. According to the Craig, the cements can be classified based upon their function. Like cements that are used for the final cementation of completed restoration, they are zinc phosphate, zinc silicophosphate, zinc oxide eugenol, or glass ionomer cement. What are the cements that are used for temporary cementation of completed restoration? They are zinc oxide eugenol or non-eugenol zinc oxide cement. So these are the classification according to the Craig. According to the Coombe classification, so According to that, the material may be classified as acid-base reaction cement, polymerizing cement, or dual-core cement. The acid-base reaction cement, they are formulated as powder and liquid. The liquid will act as acid and powder will act as base. On mixing the two components, an acid-base reaction takes place that will result in a viscous paste that hardens to form a solid mass. Second are the polymerizing cements. They set by polymerizing reaction that may be light activated or chemically activated. Example of it are resin-based cement. Dual cure cement are those cement they can set either by acid base or by polymerization, that is light activated or chemically activated mechanism. We can classify the cement according to the ADS specification, type 1 and type 2. Type 1 are the fine grain that are used for cementation, luting, and type 2 they are medium grain that are used for bases and orthodontic purposes. According to Donovan, the cements can be conventional cements or contemporary cements. Contemporary cements, they are resin modified GIC or resin cements. Now let us discuss the ideal requirement of cement. What are the ideal requirement of cement? The cement should be non-toxic and non-irritant to the pulp and the tissue. It should be insoluble in the oral cavity. It must present with mechanical properties. It must be adhesive to the enamel and dentin. It has a bacteriostatic and obtunded effect on the pulp. It should provide all the three thermal, chemical as well as electrical insulation. So let us discuss the characteristic properties of these dental cements. The first comes the film thickness and consistency. So film thickness, it is an important property especially for the luting cement. The thinner film, it is more advantageous to luting. Why? It improves the setting of restoration, it helps in greater flow and wetting of the tooth and restoration surface that will improve the bonding. It minimizes the air spaces and structural defects that are present in the bulk of the cement. Remember the film thickness, it is measured in micrometers. According to ADS specification, we can classify the minimum film thickness for the type 1 cements. It should be not more than 25 micrometer, and for type 2 it should be not more than 40 micrometer. So remember the value for your entrance point of view. The ultimate film thickness, it will depend upon the particle size of the powder, concentration of powder in the liquid, viscosity of the liquid, consistency of the cement and amount of the force. Next important property is the viscosity. Viscosity, it is the resistance of liquid to the flow. It is measure of the consistency. What are the factors that affect the viscosity? Increase in the temperature and time will increase the viscosity of certain cements. What is setting time? It is the time elapsed from the start of mixing to point at which the mixer reaches a desired hardness or consistency. Working time, it is the time elapsed from the start of mixing point to the point at which the consistency of material is no longer suitable for its intended use. Next important property is the strength. According to ADS specification, it recommends that the standard luting consistency of dental cement, it must exhibit a minimum 24-hour compressive strength of 70 MPa. So most cement, they are comparatively weaker when compared to the restorative materials like the amalgam and composite. So the strength, it will depend on the application. For example, a cement used as base under amalgam should have sufficient strength to withstand the condensation forces. Many dental cement as well as restorative material continue to gain strength with the time. So for this reason, patients they are advised to wait at least 2 hours before any food is placed in the mouth. In addition, the side in which the restoration has been placed, it is avoided for further 24-hour period. Solubility and the disintegration. It is that property that can determine the long-term survivability of the restoration. Like the solubility of the and the disintegration of the cement at the margin can eventually lead to problems like the inflammation, like the caries, like sensitivity, etc. So the water-based cements they are more soluble than the resin or oil-based cement. With the decrease in powder liquid ratio, there is higher solubility and disintegration rate. So these are the figures showing the maximum permissible rate of the dilution of the various cements. What is remaining dentine thickness? Suppose this is the pulp floor. The remaining dentine thickness, it is the minimum thickness of the dentine left between the pulp floor and the dental pulp. So this thickness, minimum thickness of dentine between the pulp floor and the dental pulp is the remaining dentine thickness. If the remaining dentine thickness it is greater than or equal to 2 mm, then you have to give cavity liner only on all internal surfaces for the metal restoration, and no liners or base is given for GIC or composite. If the remaining dentine thickness it is less than 2 mm, the base must be given on the pulpal and the axial floor. And if remaining dentine thickness is less than 1 mm, cavity liner it is given on all internal surface over which a base is given. The luting mechanism can be non-adhesive, there is micromechanical bonding as well as molecular bonding. Now coming to the cement, the first is the zinc phosphate cement. The zinc phosphate cement, it is the oldest of the luting cement. It was first introduced by Otto Hoffmann. What are the application of zinc phosphate cement? It is used for luting of restorations, luting of orthodontic bands, temporary restoration, or as a high strength base. So availability, it is available as powder and liquid system. What is the composition of zinc phosphate cement? It contains powder and liquid. The powder is zinc oxide, that is the principal constituent. Magnesium oxide and other oxide are present, like the bismuth trioxide, calcium oxide, barium oxide. What is the liquid in the zinc phosphate? It is the phosphoric acid. Phosphoric acid, water. The purpose of phosphoric acid is to react with the zinc oxide, whereas the water that controls the rate of reaction. It has a aluminium phosphate, or sometimes there is zinc phosphate that act as a buffer to reduce the rate of reaction. How is it manufactured? The ingredients they are mixed and heated at temperature between 1000 degrees Celsius and 1400 degrees Celsius. The process is sintering. After the sintering, the cake formed it is cooled quickly. So that causes the material to crack. That helps in grinding of material to fine powder. This process is fritting. The liquid it is produced by adding aluminium and sometimes zinc or compound into orthophosphoric acid solution. So when the powder it is mixed with the liquid, the phosphoric acid attacks the surface of particle and it releases the zinc ions. The aluminium in the liquid it is essential for the cement formation. This aluminium will complex with the phosphoric acid and the zinc ion to form zinc aluminophosphate gel. So the reaction is exothermic. So the set cement it has a core structure consisting of unreacted zinc oxide particles embedded in a matrix of zinc aluminophosphate. So what is the powder liquid ratio? The powder liquid ratio it is 1.4 gram to zero point 0.5 ml. So the amount of powder that can be incorporated into given quantity of liquid, it will determine the property of mixed mass of cement. The powder it is dispensed on the glass slab and is divided into 4 to 6 increments. The powder is incrementally incorporated into the liquid, speculated over large area to dissipate heat as the reaction is exothermic in nature. So during the middle of mixing, the larger proportion they are added to further saturate the liquid. Finally, the smaller increments they are added to get the desired consistency. Remember, each increment it is speculated for 15 to 20 seconds. The total mixing time is 60 to 90 seconds. So according to the Phillips, the mixing time is 1.5 to 2 minutes, working time is 5 minutes, and the setting time is 5 to 9 minutes. What is frozen glass slab technique? To prolong the working time and shorten the setting time, the glass slab is cooled at 6 degrees Celsius or minus 10 degrees Celsius. So that is frozen glass slab technique. So mechanical properties, these are the mechanical properties. The compressive strength is 1.4 megapascal, tensile strength 5.5 megapascal, elastic modulus is 13.5 gigapascal. So remember all these values. What are the factors that will affect the setting time? Powder liquid ratio. Reducing the powder liquid ratio will increase the working time as well as the setting time. Temperature. High temperature accelerate the reaction. Cooling the mixing slab is one of the most effective way of slowing down the reaction and prolonging the working time. More the liquid, slower will be the reaction. The reaction will be slower if the powder is incorporated slowly. Longer the mixing time, slower is the rate of reaction. The pH of cement, well, the acidity is high at the time of insertion due to the phosphoric acid. At the time of cementation, the pH is 2. As the time passes, the acidity reduces. By the end of 24 hours, the pH is 5.5, which is still in the acidic range. So very thin mixes must be avoided as it can be highly acidic. Pulp protection should be given as it is acidic, so higher powder liquid ratio must be used, or we can use calcium hydroxide or the cavity varnish. Adhesion is by mechanical interlocking of the set cement with the cavity surface roughness that will act as good insulator. The modified zinc phosphate cement that will include the copper and silver cement, zinc phosphate cement or the fluoride cement with stannous fluoride that will have higher solubility and lower strength due to the dissolution of fluoride. There will be fluoride uptake by enamel that will reduce the enamel solubility and will be anti-carcinogenic. Silicophosphate cement, presence of silicate glass will cause translucency, improve strength, and release fluoride. The type 1 is used for cementation of fixed restoration, type 4 for the provisional restorative material, and type 3 is used for the dual purposes. So the composition is the zinc oxide, that is the principal ingredient that is in the powder form, with addition of silicate glass, fluoride, and mercury. The liquid here is orthophosphoric acid that will react with the zinc oxide, the powder. So property: working time 4 minutes, setting time 5 to 7 minutes, compressive strength 140 to 170 megapascal, tensile strength 7 megapascal. So the important thing is that it is anti-carcinogenic due to the fluoride release. So it has a better bonding than zinc phosphate cement, better strength, toughness, abrasion resistance, fluoride release, and translucency. Whereas the disadvantage are total acidity greater than the zinc phosphate and is highly shows highly solubility. The next is the zinc oxide eugenol cement. It was first introduced by Chrysostom in 1873. It is, it is the commonly used cement for luting and intermediate restoration. These cements are the least irritating of all dental cement, so that is why they have an obtundant or sedative effect on the exposed dentin. Application: they can be used as long-term and short-term luting agent, can be used as temporary and intermediate restorations, as a root canal sealers or the surgical packs. According to the ADA specification number 30, they are of four types: type 1, type 2, type 3, and type 4. Type 1 is for temporary restoration, type 2 is permanent cementation of the restoration, type 3 is temporary restoration of thermal insulating bases, and type 4 is the for the cavity liners. It is dispensed as two paste, that is powder and liquid. The powder here consists of zinc oxide, that is the principal component, the white rosin that reduces the brittleness of the cement. So what is the function of white rosin in the zinc oxide eugenol cement? It reduces the brittleness of the cement. It has zinc stearate and acetate. The stearate acts as an accelerator and zinc acetate improves the strength of the cement. The liquid, what is the liquid component? It is the eugenol or the oil of the cloves along with the olive oil. So the setting reaction and microstructure are same that of zinc oxide eugenol impression paste. In the first reaction, there is hydrolysis of zinc oxide that take place. So water, it is the essential component for the reaction. The zinc hydroxide reacts with the eugenol to form a chelate, that is the zinc eugenolate. So the set cement, it consists of particle of zinc oxide embedded in matrix of zinc eugenolate. So the reaction is reversible. Zinc eugenolate, it can be easily hydrolyzed by moisture in the oral cavity to eugenol and zinc hydroxide. So powder liquid ratio is 3:1 to 4:1. The powder and liquid, they are incorporated into the glass slab. The zinc oxide is incorporated into the liquid. Vigorous spatulation in the circular motion is required with stiff bladed stainless steel spatula. The larger increments they are incorporated first, with the smaller increments till desired consistency is achieved. More powder is added to mix to make it strong and more viscous. So these are the properties of the zinc oxide eugenol cement. So important factor is it has an obtundant effect. So it gives a mild pulpal response with minimum with volumetric shrinkage of 0.9%. Remember, when it is direct contact with the connective tissue, it is an irritant. So which cement is least irritating of all cement? It is the zinc oxide eugenol cement. Which cement has obtundant properties? It is the zinc oxide eugenol, as it inhibit the growth of bacteria and have a soothing effect in the deep cavities, and hence it reduces the pain. So these are the advantages and disadvantages of zinc oxide eugenol cement. It has an obtundant effect, good sealing ability, resistance to marginal penetration, good thermal insulation. The disadvantages are low strength, low abrasion resistance, micro leakage, disintegration into the oral cavities. It is less anticarcinogenic, solubility is highest among all cement. To overcome the shortcomings of zinc oxide eugenol cement, reinforced zinc oxide eugenol cement was developed. It was used for cementing crown and FPDs, used as cavity liners, base materials, or for the provisional restoration. So it consists powder, that is of zinc oxide, synthetic resins, accelerator. The liquid is eugenol dissolved resin. The setting reaction is as similar to zinc oxide eugenol cement. The manipulation is as similar to zinc oxide eugenol, but it requires more powder for cementing the mix. More proper powder liquid ratio must be followed for adequate strength properties. The mixing pad or glass slab should be dry. These are the properties of the reinforced zinc oxide eugenol cement. The solubility is lower than that of zinc oxide eugenol cement due to the presence of the resin. So these are the advantages and the disadvantages. Other is the EBA modified zinc oxide eugenol cement. It is used for cementation of inlays, crown, FPDs, and provisional restorations. So it has aluminium oxide along with the powder, that is zinc oxide, along with the polymethyl methacrylate. The liquid is eugenol and EBA. So these are the properties: setting time, film thickness, compressive strength, tensile strength, all the values. Calcium hydroxide cement. It was first described by Hermann in 1920. It is a water setting cement that has both osteoconductive as well as osteoinductive property. So what is use of this cement? It is used as pulp capping agent that facilitates the formation of reparative dentin due to its nature of alkaline pH, antibacterial and protein lysing property. So it is used for direct and indirect pulp capping as a low strength base beneath the respiration for the pulp protection. It is also used as in epexification procedure in young permanent teeth where the root formation is incomplete. So it is available as two paste containing base and catalyst paste or single paste in the syringe form. So these are its application. It is used in deep cavities, intracanal medicaments, direct and indirect pulp capping as well as epexification procedures. So composition, it has a base, two paste are available with base and catalyst. In the base, there is the calcium tungsten or barium sulfate that act as radiopacifier. Other components are tribasic calcium phosphate, zinc oxide, and glycol salicylate. The catalyst contains calcium hydroxide, zinc oxide, zinc stearate. So the setting reaction involves the calcium hydroxide that reacts with the salicylate, forming a chelate, that is amorphous calcium disalicylate. The hydroxyl ions from the cement will neutralize the acid produced from the glass cells and contain and create a optimal pH for pyrophosphatase activity that is necessary for the mineralization. Properties: the calcium hydroxide has a poor mechanical properties. However, they are better than the zinc oxide eugenol cement. So it has a low compressive strength with low modulus of elasticity. If used in sufficient thick layers, they will provide the thermal insulation. The solubility in the water, it is high. The cement, as we know, it is alkaline in nature. What is the pH? The pH will range from 9.2 to 11.7. So this high pH is due to the presence of free calcium hydroxide in the said cement. So due to the high alkalinity and antibacterial and protein lysing effect, it is effective in it is helpful in the formation of the reparative dentin. The material is sensitive to moisture and does not adhere in the presence of blood, water or saliva. So it activates the enzyme like alkaline phosphatase that is responsible for mineralization. Free calcium hydroxide helps in the remineralization of the carious dentin. So these are the advantages and disadvantages of calcium hydroxide cement. The light activated calcium hydroxide cement. So it consists of calcium hydroxide and barium sulfate that is dispersed in urethane dimethacrylate resin. So it has a barium sulfate, urethane dimethacrylate. So these are generally opaque and have a longer working time. So these are the advantages of the light activated calcium hydroxide cement. Dicel. So it is used as liner pulp capping in deep cavities. Calixil. Calcium hydroxide with sodium and potassium salt is calixil. It allows the maintenance of normal dentinogenesis by protecting the pulp against irritation from the operative procedures. Apart from that, calcium hydroxide can be used as root canal sealer. The example are the Seal Apex or pulp dent. Next is the polycarboxylate based cement with the silicate cement. In that we are going to discuss first is silicate cement. So it is the oldest direct tooth colored material that was discovered by Fletcher. So it is the setting reaction is acid base reaction. The powder particles, they are attacked by acid releasing calcium, aluminum and fluoride ions. So these ions precipitate as phosphatase that forms continuous cement matrix along with and forms a silica gel. The fluoride ions don't take part in the reaction, they are present as free ions. So most of the particles are not dissolved, only the surfaces are dissolved. The set cement will contain phosphate matrix containing unreacted powder particles that are surrounded by acid gel and fluoride ions.
So remember the silicate cement, it is anti-karyogenic as it releases a large amount of fluoride. It is soluble in saliva, high in acidic condition. The coefficient of thermal expansion is as close to tooth structure. It has good optical properties. pH remains low as 3 for few days that can cause pulpal irritation. The pH remains below 7 even after a month. That is a severe pulpal irritant. It bonds. The adhesion is by mechanical bonding to the tooth structure. The advantages are translucency and it is anti-karyogenic. The disadvantages are it is a high pulpal irritant and with high solubility. The other is polycarboxylate cement. It is the first cement with adhesive bond to the tooth structure, also known as polyacrylate cement. It is used as a luting alloy restoration, thermal insulating base, used for cementing orthodontic brands, cementing stainless steel crown in the pediatric dentistry. The powder contains the zinc oxide, magnesium oxide, aluminium oxide, stainless fluoride, and the liquid is 40% aqueous solution of polyacrylic acid. The powder particles they are attacked by the acid releasing zinc, magnesium, tin ions. The ion bond to the polymer chain via carboxyl group. Ion also react with the carboxyl group of adjacent polyacid to form cross-linked salts. So the polyacrylic acid it reacts with the calcium ion via the carboxyl group on the surface of enamel and dentin. The powder liquid ratio is 1.5 is to 1 milligram. The most of powder should be incorporated in liquid in one large increment mixed over smaller area with a stiff spatula blade. The working time 2.5 to 3.5 minutes. The setting time 6 to 9 minutes. Solubility in water is low. Reduced powder liquid ratio will increase the solubility in the oral cavity. So these are the properties of the polycarboxylate cement. So it has a good biocompatibility, low intrinsic toxicity, rapid rise in pH toward neutrality with fluoride releasing ability. So remember the polycarboxylate cement it shows chemical bonding to tooth structure and alloy. It has low irritation, easy manipulation, adequate strength, low solubility, adequate film thickness, and is anti-karyogenic. The disadvantages are lower compressive strength, greater viscoelasticity, short working time.